The following presentation will discuss the first part of dive medicine and physiology, descent. When discussing the descent portion of any dive activity, it's important to understand Boyle's law, which states that there is a relationship between the volume of a gas and the pressure exerted on it. That relationship is inversely proportional. So, as the pressure increases, the volume will decrease. You've likely felt Boyle's law if you've ever dove into a body of water deeper than 5 or 10 feet, likely feeling pressure on your eardrums that ultimately resolves if you were to swallow or go back up to the surface. Because water has a higher density and weight than air, it's more easily able to exert pressure changes on a body. As we mentioned earlier, you'll feel this if you dive 5 or 10 feet below water, likely on your eardrums first. Whereas if you go up or down a stairwell 5 or 10 feet, you won't notice any change at all. For terminology's sake, at sea level we're considered to be at 1 atmosphere of pressure. Moving on to the chart at the bottom of the slide, you'll see the relationship between depth, pressure, volume, and density. As you move from sea level to 10 meters, your pressure goes from 1 atmosphere to 2 atmospheres. This relationship continues for 20 meters and 30 meters. The volume, however, of any air-containing vessel will change proportionally. As we mentioned earlier, it will decrease as the pressure increases. So by the time you get down to 30 meters, where you're at 4 atmospheres, you have 1 over 4, or 1/4 of the original volume of air. Taking this a step further, that would mean that your density of that air is 4 times as much. Looking at the balloons, imagine that we had a balloon starting at sea level and took it down to 30 meters with us. As we descend, the volume of that balloon would go from 1/2 to 1/3, ultimately to 1/4 of the original volume, but the density of that air would increase 4-fold. When diving, there are 4 areas that contain air and therefore affected by changes in pressure: the lungs, GI tract, your sinuses and middle ear, and the mask space. The mask space is iatrogenic in that it only occurs if a mask is worn, and is that space between the plastic in the mask and your actual face. First, we will discuss how the lungs relate to descent. The lungs themselves are relatively unaffected by descent. What is affected is the air from the air tank going into the lungs. As we've already discussed, going deeper will decrease the volume of air. So, when you're at 30 meters, it will take you 4 times as much air to fill your lungs. The takeaway point from this slide is essentially, the deeper you go, the quicker you use the air in your air tank. So, somebody diving at 10 meters ideally can dive twice as long as somebody diving at 30 meters because they will take up twice the amount of oxygen or air at the deeper level. In relation to the gastrointestinal tract, during descent there's very little change that will occur. In relation to the sinuses, there are 4 sinus cavities affected: the ethmoid, sphenoid, frontal, and maxillary sinuses. The problem is referred to as sinus squeeze, where the decrease in volume of the sinuses creates intense pain. The solution is quite simple, in which the diver will equalize by pinching their nose and essentially creating positive pressure, or the Valsalva maneuver. Moving on to the middle ear, the problem is similar, except this time it's called ear squeeze. This can be more dangerous in that it can create pain, hemotympanum, or even a ruptured tympanic membrane. The solution is the same as for the sinus squeeze. You need to equalize, most commonly utilized by a Valsalva maneuver. The following slide will give us a representation of what happens during ear squeeze. As we go to deeper and deeper depths, the pressure on the outer ear canal will increase, exerting more force onto the tympanic membrane. As that force increases, it can cause the tympanic membrane to bulge inward, and the first thing that will happen is you'll get an influx of blood and fluid. which is why you would end up with hemotympanum. If the pressure continues to increase, you'll eventually rupture the tympanic membrane. A ruptured tympanic membrane underwater is very dangerous because this can lead to intense feelings of vertigo, nausea, vomiting, and the desire to immediately ascend, which, as we'll talk about in later slides or presentations, is dangerous. In order to fix the middle ear squeeze, you need to do the Valsalva maneuver, which essentially will force air up through the eustachian tube into the middle ear, which will cause a positive pressure, which will balance out the external pressure from the water, and essentially you will have an equilibrated outer ear and middle ear. Divers have to do this frequently, every couple feet or meters, while they're descending, to constantly adjust for the changing depth and pressure. The final type of squeeze that we'll discuss is related to that artificial airspace from the mask. This is known as mask squeeze. Commonly presents as pain, subconjunctival hemorrhage, facial ecchymosis, and at times visual disturbances. This is a very simple problem to fix. The diver simply needs to exhale through the nose. This will increase the volume of air inside the mask space and prevent any problems. It is not uncommon for people diving to experience the inability to equalize, and this occurs often when they've gone too deep and the pressure is too high for any Valsalva maneuver to overcome. An example on this slide would show that if you go too deep, the pressures against that tympanic membrane will be very high. And despite Valsalvaing and introducing positive pressure into the middle ear, you cannot overcome the external ear pressures. The way to fix this is to stop descending and actually ascend a small portion, ascend a small distance, so that the pressures in the external ear will decrease to a level where a Valsalva maneuver can overcome it and achieve equilibrium. Most commonly, issues with squeeze will occur in new divers or divers attempting to complete tasks while descending, and they're not paying attention to their need to exhale nasally or frequently Valsalva. The final topic that we'll discuss in relation to descent is nitrogen. Nitrogen can produce two things: narcosis and decompression sickness. In discussing nitrogen narcosis, it's important to understand that 78% of air is composed of nitrogen. When a diver goes to an increased depth, this increases the partial pressure of nitrogen. Generally, when you get greater than 30 meters deep or around 100 feet, the nitrogen will be able to cross the blood-brain barrier and create symptoms of impaired judgment, coordination, anxiety, panic, and a disregard for safety. There have been stories where divers have begun to take off their safety gear and even their breathing apparatus because of nitrogen narcosis. It's also known as Martini's law, a rudimentary law where it states that for every 20 meters of diving deep, it's equal to drinking 1 martini, and also known as rapture of the deep. Nitrogen narcosis is best avoided by not diving deep, but thankfully the symptoms will resolve with ascension, which is why it is important to dive with a buddy who might be able to identify somebody under the influence of nitrogen narcosis and safely guide them to a safer depth. Decompression sickness is the other nitrogen-related problem that results from diving. Essentially, the deeper you go, nitrogen will dissolve. We've already discussed what happened when that nitrogen dissolves and goes into the blood-brain barrier, but it can also go into your body tissues. And per Henry's law, as there's an increased density of a gas, it will increase the amount that will become dissolved. So remember, in the earlier slides we talked about the deeper you go, the volume of air will get smaller, but the density will increase. So every breath you take will actually have more nitrogen than you would at sea level. That nitrogen will essentially, because of the partial pressures and the depth, will dissolve into body tissues. And the longer and deeper you dive, the more dissolved nitrogen in your body tissues. Now, when you ascend back up to sea level, the pressures go back to normal. You might go from 4 atmospheres back up to 1 atmosphere. As you do so, that nitrogen will come out of its dissolved solution and go back into gaseous form. If you ascend slowly, that gives your body plenty of time to take that nitrogen out of the dissolved solution back into the gaseous form, and you breathe it off. However, if you ascend too rapidly, that nitrogen will form large gas bubbles in your blood, which can result in many problems, most commonly known as the bends. That specific problem, decompression sickness, during a rapid ascension is something that we'll talk about in a later presentation. The way that you can understand decompression sickness better and the activity of nitrogen in the blood at depth is similar to a soda can. The soda can on the left represents our body with nitrogen as we've been diving deep. The nitrogen is dissolved, and it's staying dissolved because we're under pressure. If we were to ascend rapidly or open up the soda can, that nitrogen would come out of its dissolved solution and very quickly become gas. This is the same thing that happens to a soda can. When you open it quickly, all of that dissolved carbon dioxide comes out of solution and into gas, creating bubbles. Same thing can occur inside the human body. And we will discuss this more when we deal with ascension and management and treatment of dive-related injuries in the following presentations.